afternoon and welcome to the Multicultural Media Online Conference. This is hosted by the New South Wales Multicultural Health Communication Service, New South Wales Ministry of Health with the support of Multicultural New South Wales. Thank you again for joining us. We have today a really good important topic. It is winter, it's come around so fast, and we're pleased to have with us Dr. Kathryn Taylor, Director of the Public Health Unit of Central Coast Local Health District. And we also have Dr. Summer Kim. Dr. Kim is a trusted GP, general practitioner by the community and well known within the Korean community in particular. But we're so pleased to have you both with us, Dr. Kathryn and Dr. Kim. Thank you so much for being with us.
Thank you, Jess.
Yes, we're going to talk about winter, which is fast approaching. As I said, it's come around so fast. You can feel a bit of the coolness now, but it is important for us to prepare for winter. And today's important topic is respiratory illness and what we can do to protect ourselves, our families, and how we can enjoy winter with the fabulous clothes that we were talking about, Dr. Taylor and Dr. Kim, about when the winter season comes. But before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues, communities who may be watching us today. And also we extend that respect to multicultural communities and refugee communities that are represented in this session. So we'll start. Dr. Taylor, the New South Wales government has recently launched a winter campaign, and it's really important for people to be aware of how important the messages are for this campaign.
Thank you, Jess. Well, as you mentioned, the weather is turning colder, and we know that those respiratory illnesses are about. Unfortunately, the measures that we take against the cold, staying indoors and snuggling up to a loved one and turning on the heater, all of those factors increase our risk of viruses which are transmitted through the air into our respiratory tract. So that's why this is a really timely topic. We know that the viruses are certainly about, and I think Dr. Kim may have some further information on that. But certainly we know that there are simple measures that people can take to prevent respiratory illnesses this winter.
And it is about preparing because, as we said, one day it's hot and then you feel the weather and also the light changes. And so it is about just making sure that you're just preparing yourself for what's ahead. Now, Dr. Kim, we understand what respiratory virus is, and let's talk about that a bit more and what specific viruses we want to be aware of this winter.
Every winter we have several respiratory viruses that will circulate, but of these there are three in particular that we want to talk to people about, and these are influenza, RSV, and also COVID-19.
And so with all of that, RSV, can you tell us more about the difference between influenza and RSV and COVID? Because we do get that test now that you can find out that you can have either what, and it's really interesting because there are these tools, there are these ways of finding out so that you know what you have.
So influenza, often people say the flu, but we talk about a specific virus, and that's influenza virus. So it is highly, highly contagious, and we often see a high number of this virus in autumn and winter. Although since summer last year, we have been seeing quite a few cases of influenza and RSV, even away from those cooler seasons. There are two main types of influenza. It's types A and B, and both can be quite serious. And within these types, we also have subtypes and other circulating strains, but we mainly divide them into these two types.
Now, Dr. Taylor, let's find out a bit more about each of the different viruses, starting with influenza in terms of how serious they can be and what are the symptoms, I guess?
Absolutely. With respiratory illnesses, they tend to affect our respiratory tract. So that's anything from our airway down into our lungs. And so we may experience, we've probably all had one, but we may experience things like runny nose, fever, fatigue, chills, respiratory symptoms like sneezing and coughing. And then sometimes, you can get systemic symptoms like muscle aches and joint pain as well. And we know that there are certain groups in the community who are more vulnerable to severe infections, and certainly both COVID and influenza can lead to serious complications and sometimes even death, unfortunately.
And that's a scary bit. I had just a colleague, and she was sick for a few weeks, and she said she's actually felt more sick having influenza than she's ever had before. So it is important to just make sure that you're just prepared for it, isn't it?
Absolutely. And I think while there may be some academic differences between how the viruses manifest, we know that they can both lead to very severe complications such as pneumonia, hospitalisation, particularly in people with risk factors or people who may be older in age. And so the great news is that they're very readily able to be prevented as well.
If you have any questions, please put them on the chat. We have Dr. Kim and Dr. Taylor to answer your questions. And now over to you, Dr. Kim. What do we do to protect ourselves and our families? We know that there are a lot of events and family events that we go to, and it's part of things that we do, because when there's birthdays or there are occasions, we like to catch up. But how can we protect our families?
Influenza is really great because the flu vaccine is so readily available everywhere really in Australia. If you remember the times when COVID-19 first came out and we never had vaccines, and you remember all the fear that we had about getting COVID. So flu vaccine is available at your local pharmacies and GP clinics. I know some workplaces also would give it for all their office workers. So that is the easiest and simple way to be prevented. And there are studies that show in vulnerable people, such as young kids and the elderly, getting the annual flu vaccine will reduce your chance of getting flu down to about 50 to 60% compared to not getting vaccinated. That's one thing. And then second thing is obviously contact precautions. So please stay away from schools, aged care, those vulnerable people around you if you do have symptoms of cold and flu, to protect those that, we love.
Do you have any, experience when the community do get really sick, and how when you had to ensure this messaging goes across to the communities?
Yeah, so not RSV, but there was one of my patients, and one of the mums told me that the daycare had to just shut down because I think about 80% or 90% of the kids got hand, foot, and mouth. So then that was about 8 to 9 kids in the whole class. They just shut down the daycare until every child was cleared. I know recently we've had a lot of cases of RSV, and some mums have actually shown me letters where daycares actually proactively sent out letters saying that we've had so many kids at this daycare confirmed to have RSV. So if your child has symptoms, please go see your doctor, get tested, and stay away until they're better. So I think, being proactive about this and sending the message out so that those who are sick don't come to daycare or aged care, work, and those who are not vaccinated getting them vaccinated in a timely manner.
And that's serious, because a center gets closed, the childcare center gets closed, kids get sick, that gets transferred to mom and dad get sick.
Get sick. Yeah.
Now, there is a link that's been showed to you on the link there in the chat, and where adult vaccination fact sheets are available in community languages. So that's fantastic for you to share that to your communities. But we also now want to show a video which Dr. Summer Kim has in Korean to deliver to the Korean community about how important it is to stay safe during winter. Let's watch this.
계절 독감이라고도 불리우는 인플루엔자는 가벼운 질환이 아닙니다. 하지만 독감 예방접종을 통해 쉽게 예방이 가능합니다. 예방접종을 통해 건강을 유지하여 즐거운 일상생활을 유지할 수 있습니다. 6개월 이상의 아기부터 모든 사람들은 매년 계절 독감 접종을 받으시는 걸 권장합니다. 특히 중증의 독감을 앓을 위험이 있는 분들은 무료로 독감 접종을 받으실 수 있습니다. 이는 다음에 해당되는 분들입니다. 6개월부터 만 4살까지의 영유아, 임산부, 생후 6개월 이상의 모든 원주민, 65세 이상인 분들과 또는 당뇨, 중증의 천식 환자, 심장병 또는 신부정 등의 심각한 질환이 있는 분들입니다. 독감 백신을 맞는 것은 빠르고 쉽습니다. 만 5세 이상이면 누구나 의사 또는 약국에서 접종을 받으실 수 있습니다. 오늘 바로 독감 예방접종을 예약하세요.
Well, thank you very much, Dr. Kim. Dr. Kim was just one of many doctors who helped support this campaign and delivering it in different languages. They're available on your New South Wales website as well as on the New South Wales Multicultural Health Service website, and you can share that with your communities. And exactly that's what we want you to please share. Now it says there in Korean, but it's in the captions, it said that it could affect vital organs. So I think, Dr. Taylor, how important that is, that we think it's a flu. It's not. It's serious. It can get serious.
That's right. I mean, we talk about these illnesses as respiratory viruses, and that's largely because they're passed through the air, so through droplets when we, talk, speak, laugh, cough, or sneeze, and by inhaling those droplets from an infected person, that's how they're transmitted. But they can affect much more than just our respiratory tract. They can certainly cause complications with our gut and our digestive system. So sometimes you can get symptoms of diarrhea, particularly in children as well. And then there can be complications where you can actually get inflammation or swelling of vital organs like the heart and sometimes even the brain. So this can all be very serious.
It can affect everything, and it's scary because you feel very sick at the same time. So you want to avoid that. Now we have a question here. Thank you so much for asking this question. And I bet I can understand that Dr. Kim, you might get this question a lot. Can the flu vaccine actually give you the flu?
I have this conversation every day because a lot of my patients will say, oh, I hate getting the flu vaccine because it gave me the flu. I was so sick last year. I'm never getting it ever again. And I tell them over and over, it's not a live vaccine. It's an inactivated vaccine. So you actually cannot get flu from this. But around the time that people come in for the flu shot, it is near winter time. You're in a medical center or pharmacy where there's a lot of sick people around you. It's just coincidence that you most likely picked up something. At the same time, if you truly did have flu-like symptoms, although things like muscle pain and fatigue, a little bit of fever can happen even from the flu vaccine. But I tell my patients repeatedly, you cannot get the flu from the flu vaccine, but I hear this many, many times every day.
So the answer is no, you can't get flu with the flu vaccine. Now, we did have Dr. Shepherd, Vicky Shepherd here in one of the sessions, and she did explain, look, if you don't feel any pain, actually, if you do feel pain or something, that means it's working. It means that it's affecting your body. So, Dr. Taylor, what do you say about that?
Oh, that's absolutely right. So when you have a vaccine, the science behind it is it's exposing your immune system, so the little army that lives in your blood, it's exposing them to something that looks like the thing we're trying to protect you against. So it might be a little fragment of that virus, or it might be, in the case of the flu, it might be the virus that's killed, so it's inactivated, or other mechanisms. But by exposing your immune system to that, it's actually sensitizing and preparing your body so that when it encounters the virus for real life, say when you breathe in some infected droplets from someone, that the immune system's primed and ready to go and fight that off before it actually makes you unwell. So we sort of joke in public health about, oh, I had a really robust immune response. So, the sorer your arm is, or the worse you feel in terms of fatigue and things, we know that that's your immune system doing its job of mounting defenses.
Yeah. Dr. Kim?
And I tell my patients, imagine how bad the flu would be if this flu vaccine, same with COVID vaccine, a lot of people say, I felt so sick after the COVID vaccine, and tell people, imagine actually getting COVID or flu. It's going to be much worse than the vaccine. So do get the vaccine.
And I think we're lucky here in Australia, in New South Wales, that I remember, and we talk about vaccination a lot. We talk about vaccination for measles, vaccination for other things that are infectious diseases. But when it comes to the flu, which is something that we all often get, here is a vaccine to reduce it. Yeah, so in terms of, being in public health, Dr. Taylor, you get this a lot. You get a lot of questions, why do we need to get vaccinated?
Yeah, absolutely. Vaccination is really the most safe and effective way to protect yourself against getting these viruses, which can have devastating consequences. And even if you don't personally have risk factors or experience the complications of these infections, you can also then, if you catch them, be contagious to loved ones around you that might be more vulnerable. So there's a number of reasons why vaccinations are just so vital for the community.
I'd like to ask this question about RSV and also COVID. Who are at greatest risk, Dr. Kim?
So traditionally, we say it's the really young infants and kids, although now we think that the elderly are also at higher risk as well. So it can affect anybody, and I have seen healthy adults who don't have any underlying medical conditions getting quite sick with RSV, but it is the little ones and the elderly and pregnant women who are at highest risk.
Now, noting that RSV and COVID, we are now very familiar with these illnesses. In terms of when you mentioned that a child care center gets closed and kids are getting sick, how can parents really well, it's a question, how can they make sure that they don't get sick as well, safety wise and in terms of spreading?
I think once you have an RSV child in your home, I think it is very hard to get it. But the idea is try to contain it within your household. Parents will inevitably get sick a lot of the times, but really it is not taking them to childcare, not letting them visit, elderly grandparents, staying until their symptoms are fully better. If parents are also having symptoms, they should really stay away from work. So sometimes, my patients have hand, foot, and mouth, and they're adults. And I ask them, do you have kids? And they say, no. And I said, where did you get that from? And they say, there's a lot of parents in my office who have young kids, and there's a lot of people coming into the office sick. So, you can transfer the virus through that way as well. So really isolation, not lockdown isolation, but staying away from people until you get better is the key.
Well, it is about the domino effect, isn't it? If someone gets sick, it gets affected in your office and then the family. Dr. Taylor, we've learned a lot from COVID. What are the things that we should still keep in mind?
Oh, look, I think it's easy to maybe get a little bit used to hearing these messages, but as we say, good old-fashioned close attention to hand hygiene. So really trying to be very pay careful attention to hand washing, particularly after you've coughed or sneezed, appropriately covering your cough or sneeze as well. So really just all those lessons that we learned during pandemic in terms of those non-medical interventions, which were formerly known as social distancing, but keeping space, keeping kids home when they're unwell from shared spaces, avoiding going to high-risk settings like hospitals or aged care facilities when we are unwell. And we know that all of those things are really effective to limit transmission. But as I said, prevention's better than cure. And so really we just keep coming back to this idea of getting vaccinated. And I think another important thing for our audience to think about is that vaccines don't work straight away. So the way that they work is by priming your immune system, and that can take about 10 to 14 days to actually have its full effect. So don't wait till everyone in the office is coughing around you or until your kids got sick, or don't, even worse, wait till you've got symptoms to think I should get vaccinated. The time to be doing it is really now. And I mean, there's ways of staying on top of what's happening with disease trends in our community. As a public health physician, that's what we get very interested in, the numbers and the data. The New South Wales Health Respiratory Surveillance Report is a great source of information on what's actually happening in our state. And we know that lately RSV activity has been very high across the state.
Dr. Kim, you were nodding about, just making sure that you're up to date. How do you, as GPs, how can this be a reminder to the community? Because you're the ones with the community and seeing them every day.
Reminder about
vaccination and, how,
I'm generally very pro-vaccine. My patients know, so I talk to them every time until they get sick of it. And if they get very upset, then I'll write a small note on their file and say, I've spoken to them 5 times about it and they don't want it. So that's one thing, And also we send out reminders, and I think a lot of GP clinics do that already, especially when there are those who are eligible for the government-funded vaccine, like the elderly, the babies, those with medical conditions. A lot of medical centres, including ours, will send out reminders to patients that it's now time to get the flu shot. So proactively educating patients
And I guess for older, for the community as well, for the leaders, it is important for us to make sure that they're delivering the correct messages. I mean, from a public health perspective.
Yeah, look, I mean, there's a lot of health information and questions out there, and it's great that we've got forums like this to be able to have the conversation. And I think there's also, we have to acknowledge that it is challenging in amongst all of the pressures that people are facing with cost of living and the busyness of life for people to actually access vaccinations. So there's been a number of initiatives from the New South Wales government and others to really try and make those vaccines easier for people to access. So in most situations where vaccination is recommended, it is free. So COVID vaccination certainly free for everybody. And for people at highest risk of influenza, so we've talked about people aged 65 and over, children aged 6 months to 5 years, Aboriginal people, pregnant women at any stage of your pregnancy, and also people with any serious health conditions that might predispose you to complications of the flu, the vaccination is funded. And you can get that not just from wonderful GPs like Dr. Kim, but also increasing number of pharmacists or in other settings such as your workplace potentially.
Dr. Kim, with your experience with the patients, they're receptive, correct? Are they happy to receive the information?
Yeah, I think though after COVID, there's been a lot of fatigue in a lot of people regarding vaccination. I remember pre-COVID, when I was still working as a GP, I saw less resistance. I think after COVID and a lot of COVID vaccinations, some people, I think they feel like they're over it.
But would you agree that the community is now aware of health issues more than ever?
Yes, they are. So we are seeing both. We have those who are now more proactive and more educated, and those who are sick of everything now, really. But yes, they are generally more aware.
Now, internationally and globally, there's been it really is important for us to understand just how important vaccination is. And I think that's why we launched this campaign in April, and to ensure people are getting ready for it. So I guess for us in terms of research and statistics, how does that play in promoting the key messages?
Yeah, that's a great question. So we certainly look to places like the Northern Hemisphere for a bit of an indication of what we might be in for this season. And we know that it was quite a severe influenza season in the Northern Hemisphere, which has then informed the strains that go into our formulation of the flu vaccine, which is great. We know there's good match there with what we expect to see. And we also know that there was a bit of influenza B around in the Northern Hemisphere as well, which potentially was playing out in paediatric settings. So it will be interesting to see, I think, what happens with the timing and scale of the flu season here. What we do know from our local understanding of the data is that usually you have a bit of an RSV wave, and then as that goes away, that's when the flu season kicks off. So I'm so glad that we're having this session today, because it is a really timely opportunity for people to think about getting vaccinated, particularly against flu. We also found out during pandemic that a lot of people were looking for information in their home language or from their home countries, and that's probably a bit of a call to action for us in government to provide that locally accessible content. But as great as it is to have messages in local language, the overseas produced content may not actually be relevant to the disease trends that are happening here. So for up-to-date information about what's happening in New South Wales and around you, I would suggest to have a look at the New South Wales Health website.
Trusted information, trusted sources. Dr. Kim, that's why Dr. Kim's video in Korean is so important, and all the other videos and resources that are available, and the links are online. If you have any questions, please let us know. We've got a few more minutes to go. But Dr. Kim, in terms of that, how that research plays in terms of ensuring that the community gets these messages and know that research is evidence-based.
That's right. So I personally love doing swabs because whenever it's a notifiable disease, I feel like I'm contributing to stats. I love it. And actually, a lot of patients, and my parents especially, a lot of them come in asking as well because they just want to know, and because how we act would be a bit different if it is one of the notifiable respiratory infections, which is COVID, influenza, and RSV. Then we know that we're going to be a bit more careful and staying away. It's, compared to a common cold rhinovirus.
Well, we have a question here. How can media do more than just inform, maybe even entertain or debunk myths to help our diverse community stay flu smart and avoid falling for flu-related misinformation? I'll go to you, Dr. Taylor, but I also wanted to say, Dr. Kim, this is crucial because from the community point of view, there are a lot of information resources that we see overseas, and we go, well, what is what I saw this from this social media, that it was this, and how do you kind of make sure that it's important for you to make sure that information is from New South Wales?
I think the one good thing is that I've noticed a lot of social media ads from New South Wales Health, and I see it popping out here and there whenever I scroll through social media, and there's a lot of them. So I think that's really good because it keeps popping up whenever you're scrolling through social media. And I think a lot of people in the community have their trusted pharmacist, they have their trusted doctor. So it'll be good to link in with those in the community to provide the right information to our patients.
So to answer that question, how can media do more than maybe it's just the services, and make sure that the sources they go to are trusted?
I think so, but I think in terms of what we can do as healthcare providers, we really do need to find out ways to reconnect with the community and build back some of that trust. And as the director of a local public health unit, I'm a big advocate of local initiatives. It's a real strength of our system here in New South Wales, that we can have these local relationships. Just in my own area in the Central Coast, we've been undertaking great partnership with the TAFEs and their Adult Migrant English program, and delivering education as well as free vaccination services into that setting, which really sort of brings the information and the services together. And I think we need to think about ways of how do we get that face work back in, and how do we restore the relationship that we have with our communities locally.
It could be maybe linking with local radio channels, because I know smaller minority populations, often they have their radio channels they listen to, which are based in Sydney, but in their own language. So perhaps linking in with them to deliver these messages could be something. And I know especially a lot of the elderly population tend to still listen to a lot of radio.
And I think, yeah, that you're right. There are a lot of community events, and it is about working as a community together. You said local activities in Central Coast where you are, but also activities from the cultural festivals that are happening, right? So just linking in. And I guess there are, I'd like to also say to the media that there are doctors, GPs, and health professionals from New South Wales Health that could provide advice, or who speak different languages, that we can organize interviews with trusted sources and information. And also, again, the resources are available on the New South Wales Health website. In terms of I guess I've always thought, there's always a lot of illnesses around. You can't stop it. It just happens. But just being aware and being informed is crucial.
Absolutely. And I think while the illnesses may not change, the technology and the strategies that we have to combat them is really fast evolving. So this year we've got a new vaccine for RSV for pregnant women. This is all quite a revolution in the vaccine development landscape. So it's a really exciting time for prevention and for vaccination, and it's great for people to just arm themselves with the information that they need to make the decisions.
And the New South Wales government has invested $50 million to improve vaccine access to vulnerable communities across New South Wales, such as culturally and linguistically diverse communities, and that's really crucial for the community. Dr. Kim, how important is that announcement to communities that you serve?
I think it's really great. where I work, it is a very multicultural community. We see people from very different backgrounds. And I think it is great that especially younger people, less so because they have a lot of access to social media, but a lot of elderly people still quite isolated and don't have access to readily available information online. So I do think it is very important that we are investing this time and effort and resources to reach out to those communities.
And you just mentioned that about how important is it for young people to get this information as well, because they're the ones also sharing this information to their loved ones. How important is intergenerational messaging, Dr. Taylor?
It's interesting. I mean, obviously, different families interact in different ways, but we do sometimes find that younger generation who may be more connected technologically may act as a conduit for information throughout the family. So we are seeing quite a disruption of, I guess, traditional ways of communication with the digital age that we're now in. So while younger people may not themselves necessarily be at higher risk of these conditions, they are a really important part of the population and the community to reach, because they do have those relationships with the other people in their households.
Yeah, I'm just going to see if there's other questions. Yes, it's been answered. So that's really, you're right, because there's technology now is you because of technology you get a lot of information from different places, but then with your community, I mean, you get to see the young people as well as the older people. So it is, how do you deliver the messages differently as a GP?
So it's interesting because I have a lot of patients who then bring their parents or grandparents who speak no English, and they don't speak Korean. So I then wonder what's going on, because I have a lot of, so we have all this Google Translator and dictionary on. So what we find is that, yes, a lot of people will bring on their families and their friends to a doctor that actually does not speak their mother language, because you trust them. And I think that's why, again, it's quite important that we, even targeting the younger people, we know that they go back and they will bring their parents in, their grandparents in, and they will deliver the message as well.
Yes, and healthcare interpreters are available by health services for the clinicians to actually engage with for sessions. But also, Dr. Taylor, there is Health Direct that's available for people to contact.
Absolutely. That's a great pathway for individualized health advice, and particularly if you're in a situation where you may not be able to access a GP, but you need some health advice. That's the Health Direct line is there.
I was actually really impressed that Health Direct actually went as far as to book an appointment in for the patients. I didn't know that. I just thought they give advice over the phone. And then I had some patients who put in new patient form and they write, referred by another health professional. So I asked them, who was this? And they say, no, I called Health Direct. It was a weekend. And the person on the line actually looked up my address, looked for GP clinics that were open at this hour on a weekend, and actually guided them specifically to a clinic. So I was actually very impressed with that. It's a great service for people who don't know where to go.
So that's a testimonial from Dr. Kim on how important Health Direct is, and there is a TIS line that they can call for 131-450 and get directed to Health Direct. We have run out of time. There's more information to talk about, but thank you so much for joining us. Dr. Taylor, any last words?
I think the time is now to protect yourself against respiratory viruses, and they're more accessible than ever. So if you've got questions, speak to your trusted healthcare provider about getting your flu and COVID vaccinations or RSV.
Thank you. And Dr. Kim, any last words?
I think we haven't mentioned the baby RSV vaccine as well. So at-risk babies under 8 months are also eligible for baby version of the RSV vaccines. So if you can also speak to your doctor about that.
Thank you so much. So again, talk to your trusted GP and health professional for any information, and also your pharmacist for getting vaccinated for influenza, RSV, and COVID. Thank you very much, Dr. Kim and Dr. Taylor, for joining us. And thank you for being with us again today. We hope you'll join us again another time, but get vaccinated, stay safe, and stay protected. Have a great afternoon.